You treat the vaccination damage, do you?
Yeah.
And you treat it with homeopathy.
Yeah.
Are you successfully in it?
It's difficult.
It's difficult. Okay.
I say
the damages from vaccination are strong, aren't they?
they're strong, and it depends the degree to which.
Yeah.
So you hear stories when the parents come in, and the worst story I heard, and I think the child may be incurable. I'm not sure, but he had his first shots and maybe the second shots 2 months, 4 months, and then he started developing fevers.
Mm-hmm.
And he maintained a fever for a year. For 1 year. Maybe it would go up and down, but for a year. But the doctors would give antibiotics too. Then he developed a skin condition like a cellulitis for another year. So he had a very, very strong vital force. It was pushing out with the fever. To maintain a fever for that long, you need the strength.
Mm-hmm.
Then he was trying to push out onto the skin, and they put cortisone on until it all went away. And I think they continued with vaccination, and by the third dose of the MMR, he completely stopped talking and communicating and understanding and everything like that. And I saw him when he was 8 or 9 years old.
Mm-hmm.
And this child came in the office. He's just running back and forth, moaning, sucking on his finger and sticking finger in the mother's ear, and always like this. Rub, 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 and just running back and forth, wanting to jump out the window. Now the problem is to me it was a clear case of apis because of the cellulitis and the symptoms that he was presenting. But because everything had been so suppressed, I knew that the suppression had to come out for him to get better.
Yeah.
But it had all been suppressed to his hindbrain here. And even with 1 dose of the 6C of apis, just 2 pellets, he was sent into quite an aggravation. And he had been to, actually, Paul, the people had taken him to Paul Herskew too, and no effect, and several other homeopaths, and not saying anything about them, but just saying this is a very difficult case, and because of the aggravation, the parents didn't want to continue. So that's also another limit to cure. Maybe, I don't know, would the aggravation be too violent that it would kill the child? It's a problem.
So what else in addition to homeopathy do you use in vaccination damage to help the body?
Yeah, I don't do anything so much except for like acidophilus and probiotics if there's been a lot of
for the immune system of the colon.
Yeah, the colon and colostrum also, because it has many immunoglobulins and precursors to many immune system functioning. So those 2 things I don't really do any vitamin therapy or chelation or anything like that. But the first case I gave you is a very extreme case. If you have one that's not so extreme, it's possible. Mm-hmm. I just had a message from somebody who they had brought the child in, 4 years of age, almost retarded, would sit and stare and drool in her head, eyes glassed, no communication except for when you came close to her, screaming temper tantrums.
Autism.
Definitely.
Yeah.
And took the case, and actually it looked like inherited a bit of the psychotic miasm from the mother. And the first remedy was meterinum I gave. And also this child bedwetting and bowel movements in her clothes and not aware, not toilet trained at all. In the first 2 days after the meterinum, completely toilet trained. And then we waited to see what would happen, and I can't remember everything, but each remedy took a layer away. But we did Madarinum, maybe carcinosin in there, Natrium muriaticum at a point. She had very sensitive hair to hair brushing and withdrawn, and each time getting better. Then we did the DPT vaccine, because that disease seemed to be the most, from the case history, she really changed after that one. So did potentized DPT vaccine. And again, it worked for a while. But then she's stuck in one place where avoiding the eye contact of others, and anytime, particularly the little brother came close to her, just violent reaction and maybe a few other symptoms. But I know that, so I gave Sakura because I know it relates to tetanus.
Mm-hmm.
And very, very good things kept improving. And that was the second to last remedy, and I've just, 6 months ago, repeated the Madarinum. And even after the Sakura, I saw her in the office. She's now 6 years of age, and at first grade, same level with all the other children, talking, playing, communication, attention, everything. She's fully functioning. And except for there was just... maybe she was getting some green snot or a bit of fishy vaginal discharge smelling. So I gave Madarinum again, and the report is she's doing amazing, really, really well now. So she went from almost retarded to fully functioning and back in. So it's a unraveling, and it takes the time. And in some cases, you have to give a remedy that then produces a fever, and it's the immune system is clearing out one of those diseases, and depending on where it's stuck, you may need several remedies to help clear those fevers. Mm-hmm. But then slowly with each fever they get better and stronger and like that.
So if you conclude, we can say that the most seen damages are allergies, asthma. If it gets very heavy, then the neuroimmune system is touched.
Digestive also.
Digestion,
the measles
neurodermitic, and food allergies, a lot of food allergies, and the sudden reaction would be fever and some acute disease. Mm-hmm. So a parent should be very careful about the decision, whether to, in Germany we can decide, we are lucky to decide, whether to vaccinate or not, and if they want to do it, to do only once.
One at a time, see what the response is, wait, make sure.
And also, help with homeopathy.
And also to not give vaccines. And in Minnesota now they have a law which many doctors still don't follow, but if the child is sick, not to give a vaccine then. Yeah. They don't necessarily understand the idea of one sickness at a time. We know in homeopathy the idea of one sickness can come, it supplants the other, and that resolves, then the original sickness comes back. Maybe they're beginning to think like that too. Yeah.
So, Kate, I thank you for your very clear explanation about the damages in vaccinations. And I think you are very courageous. And I wish you good luck and to be very strong for the future. And some more books.
That in time, maybe I've stood behind this and I've studied it more, and I know that this is the way, and I'm not going to kill myself over, forcing anybody, and if, the powers that be try to suppress this, hopefully it will keep just going without that.
Thank you very much.
Okay.